The central point or the core of opium can be explained in one word: insensitivity.
It is interesting to observe how the disease originates and progresses in opium. During the normal state and before the beginning of the disease, these people are very sensitive. They understand and appreciate the environment and associate with circumstance, time and space properly. They are clear in their mind and are active mentally and physically. Their association with people and society is normal. The only thing they cannot bear is pain, to the extent that they weep from pain. So, they are like any other individual living a healthy life.
However, insensitivity is not the theme right from birth. It is important to understand that this insensitivity develops later during the evolution of the disease phase in opium.
There is progressive deterioration of the condition, and the person who was courageous and fearless turns into a coward. One who was active becomes inactive, and the one who was sensitive becomes totally insensitive. The insensitivity also extends to the physical plane. Even if they fall, they do not feel the pain. There was a case of a gentleman who would jump on his head from a height of 5 feet on a marble floor. As soon as he jumped, one would hear a loud noise, as if of the breaking of a coconut. If you saw it for the first time, you might feel that that person would die. But within 2 minutes, he would get up laughing and would be back on the table to jump again. He would repeat this act of jumping at least 7 or 8 times every night. This is the kind of insensitivity seen in opium. A child may fall down and fracture his leg, but will not complain of pain at all. He will continue walking in that condition for hours. The pupils get fixed and are insensitive to light. This is a very important point in differentiating other remedies.
The gastrointestinal tract is also insensitive to the pressure of stool, as a result of which there is marked constipation. The stool is so hard that it has to be removed with fingers, and even while removing manually, they don't feel any pain at all. He says he is well when he is sick. This shows the insensitivity to environment.
He has no feeling or sensitiveness for anything or anybody. He can speak falsehoods without any hesitation. He can be cruel and insensitive to animals. Anacardium tarantula. He is simply indifferent to the surroundings. The most important causative factor is shock, a kind of shock which can trigger off the state of the disease. It could be a physical shock, like an accident, a trauma, or a mental shock, like a sudden noise. Fright, +5, fear, +5, the sight of an accident, or an enemy, a pleasant surprise, or excessive joy. This is the origin of the evolution of the disease, which develops into a full-blown picture of opium. Other causative factors are anger, +3, vexation, +3, disappointment, grief, injuries, shame, and any disturbance which is not expected or warranted in life. Other than shock, there are few more causative factors, the most important being alcohol. They cannot consume alcohol at all, and even if they take a little of it, all physical and mental conditions get aggravated.
Apart from insensitivity, such causative factors also produce a state of confusion, a state when the clarity level is 0. They become absent-minded and remain absorbed or buried in thoughts all the time. The behavior tends to become childish, as evidenced by monotonous, irritating singing. Speech is incoherent and without any meaning. They cannot understand what was read or cannot write what is desired. In such a confusion, they are not able to perceive or understand any external stimuli.
As the insensitivity coupled with confusion progresses deeper, they reach the level of blissful contentment. They are happy in their own world and do not like to be disturbed from their reverie.
They may crawl or roll on the floor.
They ask for nothing, have no demands, and are so contented they forget all ailments and pain, that you feel that they have renounced from worldly affairs and have lost contact with reality. They appear as if they are in the state of a dream. They desire solitude and thus say that they are well when actually they are sick. If you irritate them or force them to speak, they will curse and swear.
During the comatose condition, which is complete loss of consciousness, he may come to consciousness, answer the points, and again revert back into coma. He will complain even in the comatose condition.
There is a strong element of guilt in Opium, as he does not do things properly. He blames himself a lot. These responses may be present in senile dementia, tarantula, lachesis. He bites himself. He feels as he has committed a crime. Unconsciousness is a very important symptom of opium. If the patient is unconscious, he doesn't respond to any of the reflexes. Patient also has suicidal tendency associated with sleep disturbances and depression. Another important point is sleepwalking. Patient unconsciously walks a long distance. He goes into a stupor very easily. Delusions of as if he is a criminal and will be executed. Delusions of animals, especially frightful animals like dragons, scorpions, etc. He sees the devil and feels that he is doomed. Delusions as if his body parts are enlarged, as if floating in the air, as if he is murdered. She thinks she is pregnant, and also beautiful, fantastic or horrible visions. He sees unusual faces. Opium has jealousy of the people around him. Time passes too quickly. Opium patient is always in a hurry to do something, and he is always wanting to complete what is in his hand. They make gigantic plans of making millions, but in reality they can never put anything into action. He is a big liar. He will claim to own many factories and offices, but in reality he doesn't have anything. He pretends to be a billionaire, but actually may be a pauper. He can cheat and fool people by his showmanship and big talks. All this does not bother him one bit due to his insensitivity. The patient is far from reality and appears to be in a state of a dream. He writes and sings obscene and lewd songs.
There are many alternating symptoms. They are
cares, worries, which alternate with exhilaration.
Depression, which alternates with elevation.
Exhilaration alternates with grief.
Cheerfulness alternates with sadness. Grief.
Fearlessness alternates with fright +5.
Generosity alternates with miserliness.
An abundance of ideas alternate with a deficiency of reason.
Exhilaration alternates with grief.
Indolence alternates with industriousness.
Mood keeps on alternating.
Weeping alternates with cheerfulness.
Alert alternates with dullness.
Easy comprehension alternates with difficult concentration.
Coward alternates with courageous.
Activity progresses towards inactivity. Give opium in cases where you see loss of sensitivity with other physical and mental symptoms.